This patient has a very healthy mouth. She's 19 years old, and her gum tissue is puffy, but it doesn't bleed. She, when upon probing, there's absolutely no hint of bleeding. There's not a point bleed, there's not a line or a triangle. And she flosses about 3 or 4 times a week. As you can see, there's not very much plaque or tartar on her teeth. This is before she actually came in to get her teeth cleaned. Behind the lower front teeth, she has an orthodontic wire, and the wire makes it very difficult for her to get all the tartar off. And she needs to come in regularly to get her teeth professionally cleaned, which everyone should have that. But when you have puffy gums like this, it's very difficult to keep them in good shape because with the floss threader underneath the gum tissue oftentimes will cut the gums. And you see the tartar behind her lower front teeth there near the orthodontic wire. And what I suggest in her situation is to use her finger pad to press against the gum tissue that moves around, and that will increase the blood flow of that area. And there I am pushing with my finger, and that will allow her to have the blood tissue or the blood in the tissue go back into the body, and eventually that will tighten the area up. She needs to be easy on flossing or she'll cut the gum tissue. Here's an example of someone who gets carried away with it. That you can see the floss that's up in the gum, and we remove the floss and you'll see the floss cut. People with puffy gums like that will often end up having that problem, and then they don't like the floss. If the person doesn't like to use their finger, it's possible to modify a rubber tip so that it's flat like a finger and be able to press on it. I also happen to like tooth and gum tonic in terms of tightening up gum tissue. Some people get really carried away, and this is an older person that's really flossed and ended up using a Proxa brush and everything's immaculate. But in the result, they have these black triangles, which in order to fix usually means they need veneers or crowns or something like that aesthetically. Here's another example of it for the lower teeth. And truly, a person needs to be able to be very gentle with that gum tissue so that it doesn't recede and that they don't need that type of work. Like I said, easy with the flossing, rubber pick, the tooth and gum time.